How would you lead or have a team reflection where you have staff who are very much against MAiD, and may even try to convince a resident or a patient that they shouldn't have MAiD?
Yeah, yeah. I actually have some personal experience with that. I think problems happen when we don't have free and open discussions, first and foremost. I think we always do better if we share broadly information that we have in general, right? Like I think COVID was a perfect example of that. We did better, even if we, didn't have specific information when we had early days of COVID, when we had information, at least we could prepare on some level, right? And so I think anytime that we have information, the better. So I think it is incumbent on leaders to enable the kinds of spaces, safe spaces, where all perspectives can be shared. But we're also very clear on what our role is if we do not. If I personally have object to the idea of MAiD, then my college, my regulatory college, and even if I didn't have one, is very clear on what I can and cannot, say to a person. I really can't impose my own personal beliefs on that. I have a duty to not cast moral judgment on a person and their decision. So I really do think it's incumbent upon leaders to be creating the spaces that allow for the dialogue, that allow for a range of opinion and belief, and that they can coexist. There are individuals on my palliative care unit that are deeply have deep religious oppose MAiD for deeply religious beliefs, and yet we work together, and we're just very respectful of each other's space around the care of these patients. And I attribute that to the strong leadership at our unit, for allowing or for enabling all of those perspectives to coexist.